name is Ellen Velasquez, and this research presentation is on pressure ulcer prevention in critically ill hospitalized children. This slide shows two pictures of pressure ulcers occurring on young children. So what is the significance of the problem? Well, the occurrence varies greatly, between 16.9% and 53% according to Baldwin. The skin is a vital organ of the body. It is responsible for protection from foreign invaders and also maintaining homeostasis. When a pressure ulcer develops, blood flow is impaired, depriving the skin and tissues of oxygen and nutrients, and also building it up with waste products. This predisposes our patients to pain, infection, which can lead to sepsis, which can lead to death, disfigurement, scarring, and alopecia. This may result in increased hospital stays for our patients and may require surgical treatment. The research question posed was, what are the risk factors of pressure ulcer development in critically ill hospitalized children? The topic was selected because the student nurse has witnessed these conditions occurring at too high of a rate in clinical. The condition is entirely preventable if we use the right interventions, but it is considered an adult phenomenon, which is not true as evidenced by the previous statistics. The student nurse's clinical hours would soon occur in the pediatric setting, so this knowledge of how to prevent these conditions needed to be translated to this population. Pressure ulcer prevention is identified as a national patient safety goal by the Joint Commission. Reimbursement is denied for treatment by Medicare and Medicaid. And also the National Pressure Ulcer Advisory Panel has called for research guidelines specifically for young children and infants. The search and retrieval process was done at Cedar Crest College's Crestman Library using the databases CINAHL, SAGE, and First Search Article First. The first search on CINAHL yielded 26 results. Limited to the English language yielded 22 results, and by adding the keywords incidence and risk, it was further limited to 5 results. The second search yielded 30 results, and limited to the English language yielded 4. The third search produced 13 results, and limited to the English language yielded 2. All of the articles were found through these searches. On SAGE, the search yielded 1,999 results, and limited to the discipline of nursing yielded 10. On First Search Article First, the first search yielded 3 results, the second yielded 7, and limited to journal sources yielded 3. Both SAGE and First Search Article First did not produce articles that answered the research question. The research critique was done using the article Protecting Fragile Skin, Nursing Interventions to Decrease Development of Pressure Ulcers in Pediatric Intensive Care. The abstract is clear and concise and includes the key elements, but does not include design. The problem identified is the fact that no true risk factors have been identified in this population. This is because the problem has not been studied extensively. No true nursing interventions have been identified, and also the national initiatives were identified in this study that were previously identified. The purpose listed as objectives is to study the incidence in this population, identify the risk factors, and also determine prevention strategies. There is no identified literature review, but previous studies are used to define the problem. 10 out of 30 of these studies were current at the time of publication, but only 3 are current today. The framework is vaguely identified as a nursing care framework. There is a descriptive, multi-center, and retrospective design, which allows for more applicability to all PICU patients. No treatment or intervention was done by the actual study, just the participating hospitals. The major variables, the dependent ones, included the clinical data of each patient. The demographic included the admission data of each patient, and the independent included the measures implemented to reduce development of the pressure ulcers. You can see these directly relate to the major concepts of incidence, characteristics, and prevention strategies of development. Inclusion criteria for the study included children admitted from March of 2006 through December of 2007 to one of the participating PICUs. Exclusion criteria was exactly opposite. The sample size was 5,346. There was a 100% acceptance rate, a 0% refusal rate, and consent was not obtained because it was a retrospective design. Each site approved the study through their own institutional review board, and the study took place in the United States at 9 PICUs through the PICU focus groups of the National Association of Children's Hospitals and Related Institutions. The measurement was done using the instruments PMI-2 score for risk of mortality, the National Pressure Ulcer Advisory Panel Staging System from 1998, and the Braden Q Scale score to identify risk. The data collectors were the bedside nurses, and they were trained prior to this study. Data collection was done using chart review from the virtual PICU Systems clinical database, which standardizes the data, and it was collected for at least 6 months on each patient. Mean, standard deviations, and medians were calculated for all continuous variables, and these were compared using unpaired t-tests and Mann-Whitney tests in patients who did and did not develop pressure ulcers. P-values of less than 0.05 were considered significant, and multiple adjusted regression analysis was used to determine effects of multiple risk factors and nursing interventions. The results. There was a 10.2% incidence of pressure ulcer development in these patients. Risk factors that were found to be extremely correlational were younger than 2 years old, PICU length of stay of at least 4 days, and therapeutic intervention devices. Nursing interventions found to be effective were repositioning, pressure reduction devices, nutrition consultation, dry weave diapers, underpads, and application moisturizer. Limitations included the fact that the sample was distributed according to resources which may have produced a bias in the larger sites. Skin breakdown may have been misclassified, and there was no inter-rater reliability. Also, some data may not have been included because of the time spent off the units or other factors. Implications for nursing practice. The study evidences that pressure ulcer development occurs in critically ill hospitalized children. It calls for more research because the current is limited, and we need to confirm effective nursing interventions. We need to examine the risks of therapeutic intervention devices on all our patients, and also we need standardization of nursing interventions. Diligent skincare needs to start at day 4 of hospital stays for our patients. But for now, PICU nurses can use the identified effective interventions in this study with fair confidence. Pressure ulcers do occur in children. The knowledge of the risks is needed to prevent the development. This presentation discussed the problem of pressure ulcer development in critically ill hospitalized children. It also described the search and retrieval process for articles pertaining to the research question. It critiqued one research publication related to the problem and identified the implications of this research for future nursing practice. Thank you.